Welcome to the Eugin Clinic. I'm Dr. Abram, and in this presentation I'm going to explain how an artificial reproduction treatment works. The first step is to make an initial visit with the doctor in order to assess your case. In accordance with your medical history and the clinical exams, he will then select and explain the indicated technique to help you to achieve a pregnancy. The necessary medical tests can be done in our clinic on the day of your first visit, or, if you prefer, you can bring us the results. In vitro fertilization, or IVF, involves fertilizing an egg with sperm in the laboratory. In order to try to obtain more than one egg, it requires to undergo hormonal stimulation. The treatment starts when you get your menstrual period. The maximum duration is up to 15 days. During this time, we will monitor the ovarian activity in order to trigger ovulation and program the exact date to obtain the eggs by follicular puncture. Follicular puncture is performed under mild sedation to avoid any discomfort. Under ultrasound guidance, a very fine needle is passed through the top of the vagina to get access to the ovaries and follicles. All ovarian follicles are aspirated and follicular fluids are scanned to locate all available eggs. Once the eggs have been obtained, they will be injected with previously selected sperm. If donor sperm is needed, it is selected by the medical team based on the physical characteristics of your partner or yours if you are a single woman. In addition, sperm donors undergo a very careful and thorough screening process to meet all necessary medical criteria for donation. After fertilization of the eggs, the generated embryos will be assessed and the best moment for the transfer to the uterus is determined. The embryo transfer is a simple procedure that takes about 5 minutes to complete. There is no anesthesia or recovery time needed. The transfer involves inserting the embryos through the vagina with a thin catheter in order to place them in the endometrium. The procedure is ultrasound guided. Immediately after the transfer, you can leave the clinic and have a normal physical activity. After 14 days, you should perform a pregnancy test. The chances of pregnancy with this technique depend mainly on the patient's age. We hope this presentation has been useful to you, and we are at your disposal if you need any more information. Both the medical and patient care team will be delighted to answer your questions at any time. We'd also like to remind you that during treatment, you have a team of psychologists that can provide support whenever you need it. Kind regards and see you soon.